Hello everyone. So this is for my health class for an annotated bibliography. I've been asked to do a health to pick an area of health interest. So my interest in health is going to be about breast cancer. So this is a very important topic for me because my mother's a breast cancer survivor. Many years ago, she was diagnosed with breast cancer. We were broken the news when I was still in high school, and it really devastated my family. And we didn't know what the outcome might be because it's cancer. It's really a lot of people die from it. But my mom is a very strong and powerful woman, so she did beat it. She still has lots of her hair, but it came at a cost of so many steps she had to take. She had to go through so much screening, follow-up imaging, biopsies, and so much chemotherapy. After every time she goes to the hospital with my stepdad, she would go through chemotherapy just to keep her hair intact and to beat this cancer. And she couldn't have done this without care navigators. They help people like her move through all these steps by helping with scheduling, explaining results, reducing barriers, and making sure patients don't fall through the cracks. In this video, I'll also discuss 3 peer-reviewed articles that are published that are related to breast cancer care navigation. Instead of summarizing them, I'm gonna talk about them in an applied real-world way and explain how they help patients. So the articles that I'm using are Patient Navigation of Breast Cancer, a systemic review by Robinson White and colleagues published in Cancer Nursing in 2010, affect the patient navigation of breast cancer screening among African American Medicare beneficiaries, a randomized controlled trial by Marshall and colleagues published in the American Journal of Preventive Medicine in 2015, and patient navigation significantly reduces delays in breast cancer diagnosis by Hoffman and colleagues published in the Journal of Women's Health 2012. All 3 focus on how patient or care navigation helps women through breast cancer screening, diagnosis, and care. So, first one, the first article is from Robinson himself. I'm so sorry, I forgot about that. The one major takeaway across all these 3 articles is that care navigation helps patients stay engaged throughout the breast cancer care process because, breast cancer, it could kill you. So you need someone. In the first article by Robinson, Patient Navigation of Breast Cancer, they reviewed multiple navigation programs, include that, I quote, navigation across many aspects of the breast cancer disease trajectory improves adherence to breast cancer care. In real life terms, it means that patients are most likely to show up for appointments, follow-ups on abnormal results, and continue treatment when they have someone helping them navigate the system. Like if a woman gets a call saying her mammogram was abnormal, that could be really scary. She is gonna freak out. But the care navigator can explain the results and what they actually mean and help schedule the next steps so the patient doesn't delay care out of fear or confusion. If they do, that's a problem, and we're gonna get into that now. The second article by Marshall, in this randomized controlled trial, Marshall and colleagues compared women who received navigation support with women who did not. They found, and I'm quoting directly, women in the intervention group had significantly higher odds of being up to date on mammography screening at the end of the follow-up period compared to women in the control group. What this means for patients is that care navigation actually helps more women complete regular mammograms. That matters because early screening increases the survivability of cancer and detecting breast cancer in the more treatable stage. So basically, for a patient, navigation might look like setting up appointment reminders, scheduling a monogram, or assistance with transportation. Small things make a difference. If you can catch breast cancer at an early stage, consider yourself lucky because no matter what, it's very deadly. And if you catch it at a very early stage, you have a higher chance of surviving it. And the third article by Hoffman, which talks about how patient navigation significantly reduces delays in breast cancer diagnosis. They found that care navigation has helped women reach a diagnostic faster. They state navigated women, especially those requiring biopsy, reach their diagnostic resolution significantly faster than like non-navigated women. In real world terms, this means women who had a navigator spent less time waiting, while the other women who didn't have a navigator waited more. Remember how I was talking about if you go to your appointments and get an early screening, you will have a higher survivability chance. But if you don't do your screening, the cancer might develop more into more stages, and your survivability gets lower and lower and lower and lower, and we really don't want that. So how can these patients, like resources, help patients? They can improve follow-ups with care, increase mammography screening, basically increase early detect. Basically, get there early. Listen to the doctors, schedule that follow-up, get that screening done as soon as possible. And therefore, your survivability rate is going to go up. But at the same time, I feel like the articles did point out some limitations. Navigation programs require funding, trained staff, and support from healthcare systems, which not all facilities can maintain, which is really sad because I did talk about my last discussion post how cross-cultural knowledge needs to apply to every healthcare professional needs to know everyone's culture and how they can learn from their cultures too. But overall, to conclude these free journals, they show that care navigation plays an important role, very important role in breast cancer care by helping patients move through complicated and emotionally challenging healthcare system while they're trying to fight a disease that has the possibility of killing them. And we really don't want that. So overall, by improving these screening rates, reducing diagnostic delays, and supporting patients throughout the process, it can make breast cancer care more manageable and more patient-centered. Thank you for watching this video.